Okay, so implants are virtually like having a new tooth where you are missing a tooth. They basically what we do is we open up your gum tissue, we place a little screw in the bone, and your bone grows onto that implant. And once the implant has integrated with the bone, which normally is like a 3 to 4 month process, we go ahead and we just screw in a fake tooth right into that screw that we have placed in the bone. So there's lots of little screws that are involved, and everything is now integrated, and you virtually have a brand new tooth where you had no teeth to begin with. Lifespan of an implant, as long as you do regular maintenance and regular follow-up, should be forever, technically. However, like people have teeth, people have implants, everything requires maintenance. If you're not maintaining the bone around the implant, if you're not doing proper hygiene, if you're not keeping that area clean, and you're not doing excessive forces on that implant, it should really last forever. Okay, so this is a very common question, and a lot of people are concerned about, okay, what's a bridge, what's an implant, what's the difference really? In simple terms, a bridge is when you anchor a fake tooth off of the two adjacent teeth. So let's say you're missing a tooth, you put a fake tooth there and you balance the load of that from the two adjacent teeth, which means that you trim the two adjacent teeth, you put caps on them, and now you've got a fake tooth stuck to the two adjacent teeth. An implant, on the other hand, you're not touching the other two teeth. You're basically anchoring a tooth where you had no tooth right into the bone rather than touching any of the other teeth. So let's say down the road you have a cavity in one of the two teeth, or let's say you've got gum disease in one of the other two teeth, and you end up losing either of those teeth. That implant is not impacted by that at all. So it's a completely independent tooth from the other two teeth. When we do an implant, there's two types of pain. You can have pain during the procedure or pain post-operatively. During the procedure, you would have no pain. We make sure that you are anesthetized and you are completely numb and comfortable before we do anything. So during the procedure, you will have minimal to no pain. I mean, the worst part would be the prick of the needle. Post-operatively, it will depend on several factors. The fact that you're doing an implant, it means that you've had a tooth taken out there. So they say that the surgery for implant placement is better than when you initially had the tooth taken out. Now, I personally don't have an implant, so I can't tell you how bad it is. But I know my husband has a couple of implants, and I know the one time he had zero pain, no complaints. The second time, he complained for like 3 days that it was sore. I mean, mind you, we give you medication, you're on antibiotics sometimes, you're on anti-inflammatory, so the pain is controlled and it is at bay, but it really depends on the patient, it really depends on your healing, it really depends on the site. I mean, disclaimer, I didn't do any of my husband's implants, but every implant is different. But generically, I can say overall, the pain is no worse than when you had the tooth initially taken out.